Hi kids, welcome back to another episode of An Old Lady Tries to Do the YouTube Thing. Yes, you're once again going to watch me put on my makeup while I talk to you about some stuff. What are we talking about today? Theoretically, what we're going to talk about today is sepsis. Also known as, let me tell you about the time I almost died. I'm still not sure where the camera is because I'm still recording on my phone because sepsis. So bear with me. I'm hoping to work out some of these technical difficulties that I'm having, which is partly why you're watching me put on my makeup today, because apparently I'm more calm and less flustered and I can follow through. This is hopefully a good striking time for me, and hopefully we'll get through this one way or the other. The one thing I do want to stress is that I am not a medical professional. I don't have any background in medicine. I don't have any degrees. I'm not a doctor. I'm not a nurse. I'm nothing. I have no medical qualifications whatsoever. I am, however, someone who has lived through sepsis. So that's my credential for today. I've lived through it. So it was early 2021. Yeah, I had to think about that because sadly I had to think about that. And I had a cough, not a bad cough, and it wasn't like a productive cough. I wasn't coughing up things that were disturbing to me. It was still very much in the time of my Sharona. So I didn't want to go to urgent care if it was something small that I could deal with. I had previously, like years previously, torn one of the muscles in between my ribs. I believe it's called the intercostal space, but I'm pretty sure it's called the intercostal space. Doesn't matter. Anyway, I had torn a spot like that on my right side years and years ago, and I was having really similar pain. So in my head, I had just torn that space again or injured it in some way. Long story short, I tried to treat this, what I thought was a back strain, on my own. And there came a point in time where I had told my husband, like, look, if it doesn't get better by like Friday or whatever it was, then we'll go to urgent care. And yeah, I wasn't feeling any better at all, and my back just hurt. So we went into urgent care. Now, what I remember of this day is going to urgent care, sitting in a wheelchair in the waiting room. I remember trying to get up on a table, like I think it was for a CT of my chest or maybe an x-ray. Again, I'm not sure. I'm very foggy on the details. And then I remember being put in an ambulance, and then I remember being at the hospital. I was at the hospital for a month. The reason I was at the hospital for a month was that I was critically, gravely ill. I was absolutely slow dancing with the Grim Reaper. I had sepsis. The information I have is from Cleveland Clinic. And as far as I understand, they're a very trusted medical source. So I feel relatively confident citing them. If I make any mistakes and by chance you are a medical professional and you need to correct me, by all means, please do so, because I, again, am not a medical professional. I'm just the patient. So what I had was a bacterial infection, and it was due to MRSA, which is methicillin-resistant Staphylococcus aureus. I'm not entirely certain how to pronounce it, but it is a antibiotic-resistant strain of staph. It got into my bloodstream, and ultimately it invaded every single organ of my body. I actually went into septic shock, so I was having end-stage organ failure. It was in every organ of my body. It was in my brain. It was in my bones. It was affecting my heart. I had an infection in the tissue of my heart. I had to have a transesophageal echo, which is where they thread a camera down your throat to look at your heart from kind of like the inside. So one of the only saving graces for me was that I didn't have an infection on my heart valves. And a heart valve infection would have, as I understood it, based on my recollections and my reading, would have necessitated, in theory, a heart valve transplant. I certainly couldn't have had any kind of transplant or any kind of surgery, really, because I was so sick. So that was terrifying. Thank God, no infection on the heart valves. But still, I ended up having IV antibiotics. I had a couple blood transfusions, and I had 4 chest tubes. Y'all, you do not want to have a chest tube. I mean, you do, because it's gonna save your life in theory. You know what I mean. But you don't want to have a chest tube. My blood pressure was so low and I was so critically ill that there was no way that they could give me any sedation or pain medication for this particular procedure. It came before the TEE. So essentially they take a scalpel, they cut your skin, they go through that muscle between your ribs, and they put what essentially is a garden hose into it. I'm not entirely certain how big the tube is, but it's large, it's not small. And they push that into your pleural cavity. So they had to insert those past the pleura into the space surrounding all of my organs to drain the fluid off. I'll definitely do a deeper dive into exactly what happened to me in the hospital, but the long and the short of it is that a team of fantastic physicians, nurses, everyone in the hospital, from the cafeteria staff to the janitorial staff to my daily doctors to the cardiologist, every single person there worked to save my life. And I'm eternally grateful to them, and I can't say how thankful I am for all the encouragement that I got from everybody. The back pain that I was experiencing that initially brought me into urgent care was actually my spine collapsing. My T6 and T7 vertebrae had started to erode from the infection in my bones and were collapsing in on themselves. So it was going towards my right side, which is why I had all the pain in my back on the right side near my scapula. So I left the hospital a month later in a cast that went from my clavicle area all the way down to essentially right above my hips. And it was to keep my spine from further collapsing. My fantastic orthopedic surgeon was concerned that if it didn't heal properly, I was going to have a spinal fusion surgery. Thank whatever you want to thank. My spine did fuse on its own, which was fantastic. So physically, I was back to relatively full health. I had definitely a long recovery period at home. I left the hospital with an arterial line. So I left the hospital and I needed 8 weeks of a mixed cocktail of antibiotics infused into my IV line 3 times a day. So that was fun, but I physically felt very good, and I was incredibly happy to be alive. We had just closed on our very first house, which was brand spanking new, and we never thought that we would be able to attain such a thing. So it was a really wonderful and joyous time. What I didn't realize, and what I've come to learn most medical professionals don't understand, for very good reasons, is that I was going to be dealing with the after effects of sepsis for a very long time, most likely the rest of my life. I struggle with saying the right word. I still struggle with swallowing. I have a lifelong fear of choking, so I'm pretty sure that definitely affects. Here we go. I know that affects my ability to swallow. So I just stay calm and I do the things that I was taught in. So I still struggle with that. And one of the things that I'm finding hardest right now is that it's really hard for me to retain new facts. For example, I got a new laptop to do this YouTube thing because I'm finding it really enjoyable to create the content, to put everything together, to learn the editing, to learn how to insert little things and music and that sort of thing. But part of the whole idea of me doing this in my 51st year was to show the progress for myself, and hopefully for anybody who's watching to see the progress. It's fine that it looks ganky right now, because it is, and that's just the way it is. But learning new software has been so terribly hard for me, and I'm really struggling with this feeling that I'm never going to be able to get it. But being able to learn these new concepts and put them into action, that's something that I really am struggling with lately, and that's really demoralizing. To not be able to figure out the program to do the webcam in like 4 or 5 times, and I just end up crying because it's so frustrating. Whew, that'll punch you right in your feels. So yeah, that's where I'm at. Let's put on makeup. I don't know what else I'm going to talk about. We'll find out. So I'm going to the dermatologist today. See, I'm realizing that I did this backwards, so here we are. I don't put on the other stuff first. Whatever, I'll just do it backwards because, you know, backwards is the way it's happening today. Ad infinitum. But I do want to mention this, Dr. Jart's, I don't know how to pronounce it, Sicapar. It is a redness eliminator. It's just a green tinted foundation essentially, but it really works very, very well. I want to say it's about $40 a bottle, maybe? I don't know, maybe editing me will come in and tell you how much it really is. Okay. It does last a really long time, and it really does help eliminate the redness. I have rosacea. I've gotten laser treatments for it, and it's incredibly improved. I will try to find a picture because, did I look like a tomato. But yeah, this really does help cut down on the redness, and it makes me feel better. And you know what? I don't really care if anybody else thinks it's fine or looks good or is helping. Maybe it's not. Maybe it's just all in my head. It's the placebo effect. I don't care. Because the one thing that I've learned in the last 3 years is that there's certain things that I just can't change about my illness and what is a disability. So I try to do the things that I can, you know. I've gotten really good at understanding what my limits are going to be and that this is forever. And I'm very lucky to be alive in a way that I can't quite express in actual words. I was so close to death that there's no reason I should be alive today. So I'm very, very grateful for that. And I do just kind of go about my days mostly thinking, you know, like I'm doing really well. Today's better than yesterday was. And I try to wake up every day with that thought in mind. Let's try to make today better than yesterday was. Sometimes it doesn't work, and a lot of times it does. Continuing to try to make every day better is, at the very least, something that is within my control. May not always happen, but I can at least strive for that. The thing I have really been trying to do research on for the last 3 years is life after sepsis. Like, what do you do after you get home from the hospital and you're healed from this infection? And what I was trying to find for the last 3 years was, what do I do about my cognitive functions? What do I do about the effects that this has had on who I am as a person? Not just the effects that it's had on my heart or my kidneys or whatever, but how it affects me and how I function day to day. There's not really much research at all about it because it's so different from patient to patient. So here we are. In October, I'm going to go see the, let me see if I can remember this word. I just had it. It's not a functional cardiologist because I don't even know that that's a thing and it doesn't have to do with my heart. It's neuropsychology. I'm hopeful that it will provide something concrete that might actually be a benefit to me. That's why I haven't been uploading, basically, is because it's super frustrating, demoralizing, just a blow to the ego, to my spirit, to my soul. And this is one of the ways I'm going to plow through it. Maybe we just talk while I put my makeup on. I edit it down to resemble something that's a full story with a beginning, middle, and an end. In theory, that's what we're hoping for. That's the goal. We'll see if we get there. I don't know. I feel like I've talked enough. My throat is really dry. I haven't drank enough water yet. Drink? Yeah, drink. I haven't drank enough water yet this morning, so I'm going to do that. I'm going to finish this up. Thank you guys for watching. I appreciate it. Leave a thumbs up if you liked it. If you didn't like it, then leave a thumbs down and tell me why, because I'm all about trying to improve. And yeah, I think I ran out of things to say. Comment, like, subscribe, share. Blah, blah, blah. Do all of the YouTube voodoo for the algorithm. Blah, blah, blah. And I don't know. Have a good day. Eat some lunch. Have a salad. Drink your water. Be safe. And hopefully I'll be back.